Assessment task 2. Presentation of journal article. Analgesic effectiveness of rectus sheath block during open gastrectomy, a prospective double-blinded randomized controlled clinical trial.
Hi Sandy, I'm Dr. Mark, how are you feeling? Your surgery went on well. You are in recovery now. Are you okay?
Yes, I feel okay.
How is your pain? How will you rate your pain between 0 to 10?
I can say it's 2 10s.
That's good. Take care. I will come and see you later. Let me know if you have any concerns.
Thanks, Dr. Mark. Excuse me, Dr. Mark, I am Nurse Ella, looking after Sandy.
Hi Ella.
I have seen these days some patients in our recovery are having less pain when compared to others. Is there any specific interventions carried out for them during surgery?
Well, that's a good observation, Miss Ella. We are following a recent research-based technique for pain management.
Well, it's interesting. Could you please explain about it?
Yes, in recent days the application of regional anesthesia techniques are gaining interest to provide safer, accurate and effective pain relief as an alternate to opioids.
Why it's important?
This is because larger skin incisions needs more opioids for pain relief during and after surgery, which pose a risk on aged population with pre-existing medical conditions involving the heart and lungs. Opioids has the potential for misuse and cause side effects such as nausea, vomiting, constipation, ileus, pruritus, altered mental status, urinary retention, respiratory complications, and increased length of stay.
Yes, Dr. Mark, I read that opioid-induced respiratory depression (ORD) is a significant cause of brain damage and death in the post-operative period.
Yes, as a nurse it's a real challenge for you in the recovery to monitor the patients for risk of respiratory depression. Yes, the intervention carried out for Miss Sandy is based on a study conducted to find out the analgesic effect of rectus sheath block during gastrectomy surgeries. They selected 46 patients scheduled for open gastrectomy and randomly divided them into 2 groups. Group A, the experimental group, consists of 23 patients, and Group B, the control group, with 23 patients. After induction of general anesthesia, rectus sheath block was performed immediately on both sides of the linea alba just below the xiphoid process to the lower part of umbilicus at 2 to 3 different sites under ultrasound guidance. Group A received rectus sheath block with 0.375% of ropivacaine under ultrasound guidance. Group B received rectus sheath block with normal saline.
Did they get the desired results, Dr. Mark?
Yes, the study findings shows that the Group A required less amount of romifentanil during surgery than Group B. Also, it is noted that the amount of bolus dose required by Group A is less than Group B during the first 2 hours after surgery. Group A requires less rescue analgesic drug than Group B for first 3 hours.
Well, Mr. Mark, however, I feel that this study intervention helps to minimize pain only for the first 2 hours. What do you think about that?
Yes, the authors of this study concluded that the RSB was administered only once before start of surgery with half-strength 0.375% ropivacaine, and hence it seems to be effective for only 2 hours for postoperative pain control. Hence it is recommended that if the catheter is inserted into the rectus sheath for continuous infusion, the RSB will be controlling pain for a longer period of time.
Yes, that's good, Dr. Mark.
Also, rectus sheath blocks has its implications in other areas too. It could be used in thoracic surgeries, gynecological surgeries, and to block larger area when combined with other regional blocks like transversus abdominis block and ilioinguinal block.
Thanks, Dr. Mark. Today I learned about a new pain control intervention. This helps to enhance my knowledge for better patient care.
Thanks, Ella.